our gathering, we are all aware, is to launch the E8 grant, which is between the E8 countries and the Global Fund. Most of you will recall that the E8 countries are countries which are trying to eliminate malaria from within their borders, and they have a common agenda to combat malaria with a specific focus at their borders.
Let me welcome you to this event, which is very important for us. We are part of the SADC family, and within that there are 8 countries on the forefront of eliminating or pre-eliminating malaria, and Zimbabwe is in the pre-elimination phase, and we are happy and glad to participate in this regional effort to control malaria.
I'd like to start by congratulating the 8 countries that formed this initiative for the great progress that has been made through the Global Fund and other donor support and through national investments. In terms of achievements, I think the E8 initiative is a great example of collaboration, and it's the type of collaboration that we are proud to support. We always say that mosquitoes do not respect national borders and boundaries, and I think that's exactly why we need initiatives such as the E8. I'd like to thank all of the participating countries for the great efforts over the years, and I think the results demonstrate the effectiveness of the partnership. I'd also like to thank our donors, a number of whom are here today, for both their financial support and technical guidance. But I think one of the reasons for this grant is we need to continue to support the region to achieve these very ambitious targets that are set out. So what does this new grant mean? So this $12 million grant that we're signing today will allow the initiative to continue its work between now, so from 2019 effectively, and until 2021, to address the shared challenges across the 8 countries, such as malaria, parasite movement, access to health services in border areas, quality assurance for diagnostics, and alignment of investment priorities. And I think that alignment is one of the really critical things that comes out of this grant. From the Global Fund side, we remain committed to providing the necessary support needed to ensure the effective implementation of the new grants over the next 3 years. We also hope that this grant will enable the E8 to maintain this regional forum for collaboration, but also importantly to intensify strategies for domestic resource mobilization. I mean, the Global Fund clearly can't do this alone, and domestic resource mobilization will be critical. But I think in this regard, the E8 has been a great catalyst for that, and actually have secured additional funding, notably $20 million through regional investment, and a recent investment of $26.5 million from the Bill and Melinda Gates Foundation, all going towards a common cause and common targets. So in terms of how this grant fits within the Global Fund mission, through the effective execution of the activities on this grant, we are looking to contribute to the long-term goal of malaria eradication. Investing in global health is also an effective way to achieve greater security and stability, to protect communities from infectious disease, and to halt emerging health threats.
I am happy to be part of this occasion of the signing of the second Global Fund, Malaria Elimination 8, the E8 regional grant, which will start from the 1st of April 2019 to the 1st of March 2022. And this is a continuation of the support with US $17 million, which has been provided to the region from October 2015 up to September 2018, extended to 2019. The Elimination 8 is a Southern Africa regional initiative formed in March 2009 in Windhoek, Namibia, when the ministers of health of 8 member states, their senior officials, comprising of the permanent secretaries, principal directors, malaria directors, and managers, as well as their implementing and technical partners, came together and committed to move the region towards malaria elimination through working together. The countries involved are Angola, Botswana, Eswatini, Mozambique, Namibia, South Africa, Zambia, and Zimbabwe. The E8 initiative was formed on the basis of the understanding that malaria knows no boundaries. Hence the need for neighboring countries to work in unison around policy harmonization, standardization, synchronization, and disease intelligence information sharing, as well as capacity building for the member states. The grant we are signing today is worth $14.2 million US, of which US $2.1 million has already been used for the extension period ending on the 31st of March 2019. And the focus of the new grant on activities that are catalytic, regional in nature, and structured to give us high impact. And the areas are as follows. Going to be working on the continuation of health post support. We're going to have epidemic preparedness and response, capacity building through maintaining of the Situation Room platform. The vector control capacity building will be enhanced. We'll be supporting Angola with indoor residual spraying and supply of bed nets. And finally, we'll be conducting a regional coordination meetings. And these areas of focus are going to go a long way in stimulating interest among our partners and funders, including the private sector, to invest in malaria elimination efforts in the region. So the signing of the SADC Malaria Elimination Declaration by the heads of states and government in Windhoek, Namibia in August 2018 is a clear demonstration of high-level political commitment. And on behalf of my colleagues in the E8 bloc, I would like to assure the Global Fund that the resources you are availing to the E8 will be jealously guarded and will be used for the intended purposes. So we further challenge our governments to increase funding for malaria elimination within the E8 bloc. I would like to thank the Global Fund for the support that you continue to give to the E8 bloc, as well as the individual member states. To all our other funding and technical partners who are working with us, we would like to continue to thank you so much for the efforts that you put in the elimination of